Australia's vaccine supply has been given a boost, as have millions of Australians, with dates set out for more freedoms, some sooner though than others. 700,000 Moderna doses touched down in Sydney overnight, a vital addition to the national supply. Victorians are pinning their hopes on lifting vaccination rates as they look ahead to 5 more weeks of lockdown. The 26th of October is when double doses are expected to hit 70%. That triggers the first real steps out of lockdown.
Restrictions will ease further when 80% of eligible Australians are double vaccinated, and that's expected on November the 5th. Meanwhile, in New South Wales, the tale of two cities has ended. Today, restrictions ease for Sydney's hotspot areas, bringing the east and west in line with each other. For all the details, let's bring in our reporters, Lara Himes in Sydney, Steph Ferrier in Melbourne. Steph, can we start with you? Because all eyes now in Victoria are on that first key milestone of October the 26th.
Good morning, Lisa. Yes, it's going to be a very long and slow path out of lockdown, but Premier Daniel Andrews says a safe and cautious one as well. So it means that Bourke Street Mall here is going to remain quiet for another 5 weeks. This 7-day circuit breaker that was supposed to just be over so quickly is now going to go for 11 and a half weeks. And as you say, October the 26th is our milestone for getting 70% of Victoria's 16-plus population double vaccinated. At that stage is when the lockdown will lift and the curfew will end as well. We will have 10 fully vaccinated people that can gather outside. 50 fully vaccinated people can head to the pub, but only outdoors. And weddings and funerals will have 50 outside only if they've had both doses. Retail will also reopen, but only for outdoor service. So many places are saying that it's simply not feasible for them to open up their doors under those conditions. And just before that, we'll also see some of the students coming back. So the Year 12s will go back on October the 5th for their general achievement test. A week later, we'll see the preps to grade 2s coming back, but only part-time. And then the rest of the students will start to return as well from October the 26th. And we'll also see on that date childcare reopening for other parents apart from essential workers, but they also will need to be vaccinated.
What's the next step then, Steph, after that? When do we see Victoria open more significantly?
Yes, so this will be in November, and the Premier is actually hoping that we can do it a couple of days early so that it coincides with Melbourne Cup Day, really putting Melbourne back on the stage as the cultural events capital, he says, of Australia. But it will be the 80% mark when we find ourselves with all Victoria's adult population fully vaccinated. And at that stage, we will see visitors being allowed in the home again, finally, with 10 people. Hospitality limits will increase for the vaccinated with 150 people indoors and 500 outdoors. 30 people can gather outside. Retail will reopen indoors as well. Fully vaccinated Victorians can return to the office, and weddings and funerals will increase to 150 indoors and 500 outdoors. And the Premier, Daniel Andrews, is hoping to see us being able to have 30 visitors in our homes for Christmas Day to create as normal a Christmas as possible. He acknowledges that this is a difficult road out of lockdown, but he says it's needed to make sure that our health system doesn't get overwhelmed. And he's pointed to the modelling showing that we're going to hit around 4,500 cases by mid-December, leading to around 3,000 hospitalisations. And he says deaths peaking at 2,200 in January. But we heard from Margaret Hellard from the Burnett Institute, the Deputy Director there, who did all of this modelling. And she says that these are just projections and they're not set in stone just yet.
There's a wide range of numbers when we say this is how many cases we think we'll have at time point A, B or C. This is the possible hospitalisations and this is the possible number of people in the ICU who might die. It's a projection. At the moment, it looks really tough to move forward through the roadmap is really tough without putting a lot of pressure on our health system. The modelling would suggest that. But things can change.
So the Premier will be looking at this. They'll be making tweaks and changes as they get real-time data going forward, and also, of course, use the New South Wales experience to inform their decisions too. But in the meantime, we're going to see pain for some of the other regions outside of Melbourne, with Greater Geelong, the Mitchell Shire and also the Surf Coast Shire all heading into a 7-day lockdown due to higher case numbers there.
All right, thanks, Steph. Lara, in Sydney, where restrictions are easing today for those hotspot LGAs.
Good morning, Lisa. Well, welcome news this morning for those 12 local government areas. They will now have the same freedoms as the rest of Greater Sydney. The easing of restrictions has come into effect, and what that means is that if you are double vaccinated from those areas, you are able to mix with 4 other people who are also double vaccinated. There will no longer be a time limit on exercise, and if you're the guest of in a wedding or invited to a wedding, you are able to go to that event if it's outside your local government area. It was something that wasn't afforded to you previously. You will now have the option to do that. Also, from next week, we know that pools are going to be open, and with these restrictions easing in those 12 local government areas, it means that the program of face-to-face learning for schools will now be on track. Everyone in Greater Sydney will be subject to the same staggered approach for face-to-face learning, and that will happen on October 25th. So some good news there.
And what about this vaccine rollout we've been talking about? Fill us in on the details.
Well, we've got 3 TGA-approved vaccines, so that is the AstraZeneca, Pfizer and Moderna. We got a shipment of Moderna overnight. We also had one over the weekend. We had 700,000 that were delivered overnight, and now that brings the stockpile of Moderna in Australia to over 1 million. The good thing about this particular vaccine is that it is approved for those aged 12 to 59. So minors can use this. It's going to be great for the stockpiles too, because obviously minors can only access the Pfizer and Moderna. Obviously, there have been some supply issues with Pfizer, but with these vaccine supplies going up, it's going to be good news for those who are aged under 18.
All right, Lara and Steph, thank you.
Let's take you to Singapore now, a nation with a COVID exit plan that largely mirrors our own.
They are a few months ahead of us with an 80% double vaccination rate, but COVID cases are still climbing to record daily numbers. So what can we learn from Singapore's strategy? Well, Dale Fisher is a professor in infectious diseases at Singapore's National University Hospital. He's also an advisor to the World Health Organisation, and he joins us now live from Singapore. Good morning. Welcome to News Breakfast.
Thanks, Lisa. A very early good morning to you.
Yeah, and we do truly appreciate it, but we've been having a look at what's going on in Singapore and a bit fascinated given what we are facing in Australia. Can we just start by checking whether the targets are the same when we're looking at these vaccination rates, because we talk about eligible numbers. What is Singapore at the moment?
So as you mentioned in the lead up, our strategy is one of a gradual exit. We're not having Freedom Day count backwards from 10 and the pandemic's over. We were about a month ago, or August 29 actually, we hit the 80% total double vaccinated number, which is about 90% of eligible. And at that stage, we were about just over 100 cases. In those last few weeks, we're now over 1,000, and our severe cases have gone from 27 to 139 in the last 2 weeks. So what we're learning is, firstly, it's very hard to keep a lid on things. It's much harder to exit slowly than it is to throw the doors open. But it also shows us that most of those severe cases are still the unvaccinated, which even if it's 10% of the Singapore adults, that's still 500,000 people, and if you extrapolate that to Melbourne and Sydney, you're going to find, possibly 1 million adults still unvaccinated, and these are putting a tremendous burden on the system, and frankly have us a bit nervous.
Okay, and I know that you hit a sort of a peak on the weekend. Those numbers are increasing. Are people watching the numbers still? Because we keep getting told, don't look at the cases, look at the hospital numbers.
Yeah, I would certainly promote not focusing on the case numbers, look on the severe cases, but it seems like whenever there's a suggestion to withdraw them, then that's raising transparency issues. So I think we're sort of stuck with the case numbers, but we have to just de-emphasize them. They don't matter. All these mild, asymptomatic, vaccinated people, they're irrelevant. They're going to keep... COVID's going to keep circulating. So what we have to focus on is the threat to the health system.
And is it under pressure in Singapore?
We've still got a lot of capacity. We've only got 21 people on ventilators, and we can easily take hundreds more. It's certainly not the ambition, though, and that would be contrary to a lot of Singapore sentiment. That is, if we do this too fast, the toll will be too high.
So what is life day to day like for Singaporeans then?
Well, it's still remarkably restricted. Masks are still compulsory indoor and outdoor, except when you're doing strenuous exercise or in your own car or your own office. Gatherings are still limited to 5. Controlled gatherings, such as conferences and weddings and things, you can go larger, but even at a wedding, you have to sit at a table of 5 and not mingle. So, I think that's the point I'm trying to make, is that we've actually not undone a lot, yet we've found these numbers jumping, and also the number of severe cases in the unvaccinated jumping. So it's very hard to exit in a controlled way, actually.
So when you're looking at this roadmap, people sort of were feeling like another 5 weeks of lockdown in Melbourne. They've been through a lot in Sydney. You're saying, well, it may still be too quick for what's ahead.
No, if your target is to get down to 0, then I think you need the lockdowns. And that's been the debate. Do you really want to get back to 0? Now that that's no longer the strategy, I think that middle of the road restrictions are needed. I think you're going to be wearing masks for a few months at least. You won't be having big crowds, because you're going to be looking at your number of people in ICU, the number of people on oxygen, and saying, do we really want to see, thousands of people at a rock concert and things like that still, when our health system is still threatened.
Hey, just finally, Dale Fisher, what happened with the Singapore travel bubble? I mean, there'd been talk, of course, of Australia having one, but that never got off the ground. But has Singapore created bubbles with other countries?
They're called travel lanes now. We've always had a nuanced system of category 1, 2, 3, 4 of which countries we're happy to come in without quarantine. Australia was one of those for a long period of time. I think you're now category 2, which basically means 7 days home quarantine and a test at the end. So we've again, and this whole structure of travel restrictions is also being eased gradually. Actually, there's no bang for your buck in travel restrictions anymore. If you're having 1,000 cases a day, yet you've got thousands of cases in quarantine to detect 10 per day, it's just not impacting on your numbers. And I think that is one thing that would be easy to get rid of without having a health impact.
The travel restrictions?
Yes.
Okay. Hey, Dale Fisher, thanks very much for your time. Really appreciate it. I know it's an early start for you, but you have an incredible insight, given you've lived there for, 18 years, is it, I understand, and as such an expert in infectious diseases.
Pleasure to be here, Lisa.
Thanks.
Travel lanes. I'd like to be in a travel lane. Anywhere.
I can put you in a travel lane, Michael.
I'd like to be in a travel lane to Queensland. Let's go to Queensland now. The state's been praised for coming out in force as part of that weekend vaccination push. Michael Rennie joins us from Brisbane. Michael, good morning. Saturday was a record-breaking day for the state, wasn't it?
It sure was, Michael. They put a football analogy in to chuck one in. There was more people that got vaccinated over the weekend than you can fit into Lang Park, because it was over 56,000 people, and they're actually still counting that because some of the vaccine hubs were open until about 8 o'clock at night. And the good news is they are planning more of these walk-in vaccination weekends, because it seems to work. People really like the idea of being able to just rock up and get vaccinated. Where I'm standing this morning is outside the mass vaccination hub in South Bank in Brisbane. And as you can see behind me, there is a lineup of people here going in, getting their booked appointments. And it's been like this all morning. So lots of Queensland still getting out this morning, even though they are booked appointments. Over the weekend, though, it was a mix of people that came out. It was actually a lot of young people, Michael. It was also parents wanting to get their children protected, and just people to take advantage of that walk-in opportunity and get themselves protected against COVID-19. We did hear some stories about people having some issues getting into some locations, and a bit of confusion around whether some places were offering those walk-in hubs or not, but I'm sure they'll try and iron all that out as we go forward, because we are tracking in the right direction. It shows you get a spike from these types of weekends. We now are at 41% of Queenslanders double dose that are eligible, and 59% of Queenslanders have had the first dose. So that means we are heading towards that 70 to 80% double dosed rate that we need to get to, and we should be reaching around 80% if we stay on this track by the end of November, Michael. So that's really good news heading in towards Christmas.
It is great news indeed, Michael Rennie. Thank you.
Australians stranded in the UK have held a protest outside the High Commission in London, calling for flight caps to be lifted. The protesters labelled the demonstration a vigil, with some having missed out on seeing dying relatives and others who've had relationships break down. All of them have found it difficult, if not impossible, to return, and are hoping home quarantine will make it possible to get back by Christmas.
The Northern Territory's tourism body has become the first in Australia to offer vaccine incentives. A $5 million summer campaign launches today, with sales on offer to fully vaccinated Australians. Travellers from non-hotspot areas will be offered discounts on flights, accommodation, tours and vehicle hire.